A mass shooting is defined as any incident where greater than or equal to 4 victims are victimized by a gunshot wound. By that definition, less than 2% of shootings in this country classified as mass shootings. So 98% of shootings that happen in this country happen with less than 4 individuals or single individuals, the majority of which are young Black and Hispanic men who have the highest morbidity and mortality when you look at CDC numbers. So not only is it an epidemic, it's an epidemic that predominantly affects poor young Black and Hispanic men. And because of such, I think is what has led to it being ignored sometimes as an epidemic, ignored sometimes as a public health issue, because of the communities that it's disproportionately affecting. But for those of us that work in city hospitals and level 1 trauma centers, we really see it firsthand. And we see the direct impact that it has, not just on individuals, but on families and communities. And we see why there's such a strong need to really have a public health approach to violence, where we not only engage in secondary and tertiary prevention, meaning that we're not just treating patients that come in and taking care of their wounds and sending them back out. We also engage in primary prevention methods where we intervene early and we get out there in the community and we try to identify individuals who are at high risk for potentially being victimized or being the proprietors of violence, to intervene at that level as well to prevent victims from ever even presenting to our emergency rooms.